At the end of the day, when you have, as a person with lived experience, and you have to pick up your autonomy and integrate back into the community, you know, your rehab and whatever, it's a real cliff effect for them. I mean, the support that they need, which is broader than healthcare, is very difficult to get. Their expertise to be supported and to be maintained in the community is sparse and fragmented. So you might have gotten really good inpatient care in your rehab facility, but that was like 200 kilometers, 500 kilometers away from where you live. And when you go back and you lived in your community, the supports aren't there. So it's really a paradigm shift of how we're going to be providing care. And that's something that was loud and clear in our needs assessment. So it influenced the next part, where we've been working on building standards for rehabilitation for people with lived experience that goes beyond the care setting, but the continuum of care.
I suppose it would be the resources after discharge, whether it's home care. So if the patient's going home and they need home care services, the resources that are available to them in home care. Home care also isn't like an endless, you know, revolving door of nurses who are just always there at your beck and call. You can't just call them and be like, I need you to come right now. They're also not going to sit there for 4 hours at a time. So, so that's something. If someone's going home, if they're going home without home care services, it's just making sure that, you know, patients are able to sort of maintain some level of normalcy in their roles, like whether maybe it's a husband or a father who got injured. Are they able to maintain that husband and father role while still asking their family for some help?
We cannot speak for people with lived experience. The people with lived experience have to be in the conversations with us. And so we have to give them that safe space. Huge learnings on that as a care provider. And I come in with my clinical experience, but my language can be intimidating for people sometimes. And there's a bit of those power dynamics. So how do you reflect back on how you speak and the language you use so that everybody gets a common understanding? And that links again to equity through health literacy principles. So everything gets connected at one point, if you think about it.
We have these public focus groups where anyone in the world can sign up. And so we've seen people dial in from New Zealand, and we didn't expect it, from Germany, from obviously the US, and we said, okay. So there's a lot of appetite for it. And so you've got situations where I think it's really valuable for companies to hear it, that we tell them, but no spinal cord injury is the same. So how do you create something that meets you know, Joe's needs, but meets Sarah's needs in a low income country? Now, I think we need to do more and get more people from low income countries, so that we are forced to build lower cost devices. And that's a whole other thing. But I think the diversity is really important for an entrepreneur to understand what they're dealing with and the constraints and the wide needs they need to address. And then they may realize that product doesn't work for a big subset. Okay, what does that mean? So I think we welcome it. And I think having differing experience where someone actually says, you know, my experience is different. Okay, what does that mean? So I think it's a really valuable and needed thing. We need more and more different voices to participate.